Hello friends, today we are going to discuss about thyroid problem, which is one of the common problems for the women especially. So how does it affect our health and what are the symptoms, how we will come to know that we have thyroid or not, and how homeopathy treats thyroid problem and how success it is in homeopathy. That we will come to know. We will see the evidence of the thyroid treatment in the form of a cured case, all those. So this is our website, drmeeta.com. Any kind of health related query if you have, you can visit our site. Besides, in the Facebook also you can log on. Dr. Meeta Clinic is the ID. And every day we are giving the health related information there. So you can see those posts. Hormonal imbalance, diabetes, etc. are some of the Alzheimer's disease, etc. are some of the latest posts in that link. So those things also you can visit there. Now coming to our today's presentation. What is thyroid? Thyroid is a gland that is situated in the neck. I can show you the anatomy in the neck. If you will see in the front of the neck, the base where the neck gets attached with the chest. So there we have got the thyroid gland like this. So even though this thyroid gland is very small, but its impact on the health is numerous. How does it affect? This gland secretes hormones T3, T4. These are the two hormones. These two hormones affects almost all activities of the body, you can say. The entire body metabolism is being controlled by these hormones. Body metabolism means what? Means the fat and carbohydrate, what it is there inside our body, that has to be broken down, from where the energy will come out as a byproduct. So that process is called metabolism. So at what rate the metabolism will happen inside our body, that is being guarded by this T3 and T4. Now when we go for T3, T4 check, associated one more hormone used to be there called TSH. What is that? TSH. Thyroid stimulating hormone. This hormone is a pituitary hormone. It is from the pituitary gland. So this is responsible to stimulate the thyroid hormone for synthesizing T3 and T4. So when T3 and T4 is less in our body, the thyroid hormones are less in our body, we find the TSH is more, that is the thyroid stimulating hormone is more, because the body wants to compensate that insufficiency of T3, T4, so that it wants the thyroid stimulating hormone to stimulate the thyroid gland more. So it secretes more TSH so that more T3, T4 can come. But comparatively, when we see the imbalance between T3, T4 and TSH is quite clear. From those levels we come to know whether anyone has a thyroid problem or not. There is a condition called hypothyroidism. As I just explained you, when the T3, T4 is less in our body, the TSH will be more. The thyroid stimulating hormone will be more. That is a condition called hypothyroidism. Hypothyroidism, when can it happen? If a lady is during pregnancy or after pregnancy, or it is also apparent during menopause and after menopause, where the hormonal imbalance are quite possible to happen, and the family history of thyroid problem is there, or the person is suffering from rheumatoid arthritis, there also he has got the he is prone to develop the thyroid imbalance, all that. What are the external symptoms, how we can suspect whether we have a hypothyroidism? Fatigue, tiredness, weakness, abnormal weight gain, frequent cold, the moon-like face, the puffy face, the menses are quite irregular, heavy menses otherwise, all these symptoms make us to suspect thyroid abnormality. Now, when we see all these symptoms, when we go to the doctor, doctor will immediately ask us for testing. Blood test will be done for thyroid hormones. Now, when we find it is, oh, hypothyroidism has come, now how to treat? So in the conventional system, how the doctor treats? They will see, yes, the hormones are less, T3, T4 are less, so you have to consume the thyroid hormone tablets every day in the morning in empty stomach. Have you ever thought whether it is the real cure of the disease? Because if any part of our body has disordered, the gland has become dysfunctional or less functional, for which the required amount of thyroid hormone is not being produced inside the body. And what we do as a treatment, we start supplying the thyroid hormones from outside. The patient need to consume that. So it is just a supplying of the insufficient quantity. Is it the real treatment? Because the disordered part, the gland which is dysfunctional or improperly functional, remain untouched by this. Unless until the gland itself is being rectified and it is being again set proper so that the normal synthesis of that hormone happens from the gland, we cannot expect, we cannot say that it is a cure. That is the reason in the conventional system of medicine, throughout the life you have to be under medication for thyroid problem. And here the homeopathy very much differs in its approach of treatment. What we do in homeopathy, first we have to find out what is the real cause of this problem. Whether the physiological milestones, pregnancy, menopause, all this, or there is any family history of this problem, or the occupational stress is a problem, or family stress is a problem, or the nutritional deficiency is the cause. We have to find out the real cause. Accordingly, we have to prescribe. Now, suppose the family history of thyroid problem is the cause. Then like this also, many patients can be there having the thyroid problem in the family. So can we prescribe one single medicine to all those? No, not at all. Because each individual having a different characteristics, symptoms than the other. One person with the thyroid problem is prone to develop more and more cold. The another person can be there who has become very much irritable, short-tempered after developing the thyroid problem, while the other one is totally asymptomatic, no symptoms at all. Only the blood report shows this is the problem. Yet another person who is having a long history of dry skin. So for last 30-40 years, he has been applying liquid paraffin to compensate that dry skin. And finally, he has reached at a thyroid abnormality. So these are the differentiating symptoms by which we will differentiate one person from the other. Accordingly, the different medicines are there in the homeopathy to prescribe. And in homeopathy, we do not have to take the medicine for the lifelong. There is no question of any hormonal intake in the form of tablets. Hence, there is no side effect at all. Now, all these things we can believe if we can see the evidence of cure. I'll show you one of my recent cases of thyroid being cured. This is the case where 10th of May 2016 we have got the report. TSH is having the value of 7.46. The normal is up to 5.5. 7.46 on 10th of May. After 2 months, 60 days of treatment, 10th of July, the TSH has come down to 4.27. 4.27. From 7.46 it has come down to 4.27, absolutely normal level now in just 2 months. So this definitely proves that yes, homeopathy has got a very promising success in treating hypothyroidism. Still, if you have any query, feel free to visit my website www.drmeeta.com. Thank you.